Thank you for joining. This is Consumers Doc, Dr. Vengala. Rising healthcare costs. Nobody wants to talk about it because healthcare keeps rising, man. $3.8 trillion, that's lots of money. Some of these countries, they don't even have that kind of revenue. $3.8 trillion is lots of money, yes. It has surpassed the national defense budget, for God's sake. And nobody wants to talk about it. Especially, it is ultimately somebody has to pay for it. We all have to pay for it by increasing taxes, raising your prices on commodities. Somebody has to pay for it, man. But what I'm saying is, as an American, you have a responsibility, personal responsibility, especially when it comes to healthcare. Yes, a lot of people don't understand. Oh, they want a Medicare for all, they want a universal healthcare. Listen, there's nothing free in this world, man. There's nothing free. Somebody is paying for it. Unless we as consumers, we have to take the responsibility. I really believe time has come for the consumers to be responsible, especially in regard to healthcare. If you take care of your health, if you take care of your body, you can make lots of money, folks. A lot of people don't understand that. If you're healthy, it's your savings is going to triple because you're putting money aside into the health savings accounts every year, year after year. It is better than IRA, folks. It is really better than IRA. I would suggest everybody, it is pre-tax. You don't have to pay taxes. And put money aside every year for a family, $7,200, for an individual, self-employed, $3,600. That goes a long way, year after year, year after year. One thing I want to emphasize is rising healthcare costs. This is the topic. Even though we have spent 3.8 trillion, where we rank in the world among the most advanced countries is really shameful. We rank 37th among the most advanced countries. With that kind of a revenue, it's just not acceptable. Insurance companies don't care about rising healthcare costs. They'll charge you, raise your premium. They're not least interested in rising healthcare. They're least interested. Whatever they bill, they try to pay for it. They're not interested. You know who's interested? You. You as a consumer. We all have to get involved and personally take care of your own health, save money, make lots of money on your health. If you have money, if you're contributing a health savings account, try not to use them. Keep accumulate, keep saving, so that will be a reserve for your future health. This is the way to go. The consumers have the power to lower the costs. If you are checking into the hospital, if they're having you to go to a rehab, if they have to do some testing, don't give your insurance card, man. Don't give it right away. Ask them, how much is it? Is that a big thing to do? Ask them before you give your insurance card. And also tell them, before they bill my insurance, I need to know. I need to sign before you bill my insurance. It's like any other policy, man. Like a home insurance or anything. If somebody is billing your insurance, you need to know. It's a common sense. Don't let anybody bill your insurance without you knowing it, especially hospitals. Hospitals have been abusing this insurance left and right, especially when it comes to Medicare. They don't care. They just bill. Medicare wastes a lot of money. There's no any government agency, they waste a lot of money because of the regulations and everything. But we as consumers have a personal responsibility in lowering the costs of the healthcare. When you have a deductible health plan, the deductible portion, you're responsible. You're personally responsible for that deductible portion. I would like to see everybody takes charge and put money aside into the health savings accounts and inquire about what they're billing your insurance. Listen, I've been in healthcare for the last 40 years. You know, I've seen it. It's especially institutions, and now, there's more consolidation going on. That's going to drive up the cost more. Hospital consolidation, medical group consolidation. This is not the way to. We need more competition, not consolidation in healthcare. And consumers will demand affordability. They demand transparency. Ultimately, they will demand transparency. And they want competition, not consolidation. Folks, thank you for listening. And we will see you in the next episode. Goodbye and God bless.